This is a nice case of Pituitary Macroadenoma that is growing in the cella and expanding supracellary. For me, I like to hang the images in this way, that I have my coronal T2 weighted sequences to see the relation of the tumor to the chiasm. Optic chiasm is visible here, and the optic nerves going forward, and you can see that the tumor is touching, perhaps lifting a little bit optic chiasm, and not that much. Then I have the coronal T1 post-contrast sequence as well as sagittal to look at the structure and the type of enhancement of the tumor. And in this case, there are interesting observations that we can see that the macroadenoma is enhancing less than the normal pituitary. So it is like light grayish compared to brighter signal of the rest of the normal pituitary tissue. And you can also see infundibulum that is deviating to the left, where the rest of normal pituitary are located. Here also on the coronal image we can observe the relation to the cavernous sinus, that we can see there is expansion into the cavernous sinus. The macroadenomas are soft tumors, so when they grow through the diaphragma cella, they can have such an effect of snowman with like two balls, but they expand into cavernous sinus here, in this case on the right. On T2 sequence we look if there are any signs of hemorrhage or cystic components that we don't see. By the way, quite clear flow artifacts we can see through the aqueduct. And then on the sagittal we can also appreciate the relation to optic chiasm, as well as this sequence. This is the T1 weighted sequence without contrast that shows the signal density of the tumor without contrast. It's also very important because, for example, high protein can show higher signal density or hemorrhage, which is not this case. Cella is enlarged, and this is a follow-up of the tumor that has grown a little bit. But yes, well-defined tumor. We do measurements in coronal, anterior, posterior, and craniocaudal planes. Okay, that's it for this case. If you found this case walkthrough helpful, please check out the other videos on my channel and consider subscribing. See you in the next case.